So if you're looking at the current scenario in the United States of America, it is clearly not looking good, and till now, a state of complete lockdown has not been imposed in the entire country. Let's get a broader perspective from our special guest joining us here on the broadcast, Archith Seshadri, who is a journalist based in the United States of America. He's joining us live from Atlanta. Well, good evening to you, Archith. Thanks very much for speaking to us here on Republic. I want your overall understanding of the situation in the United States of America and how Donald Trump, do you believe, has misled the nation, or in a way, he, according to what he says, is saving thousands of lives till date, as the numbers we are looking at is not looking very good at all, with more than 2,000 lives being lost in one single day. Archith.
Yeah, absolutely. I think the concern at this point is it's hard for most people to believe that the United States can be the epicenter of something like this, a global pandemic. In fact, we just got the numbers a short while ago. The U.S. has more than 600,000 people who are infected, the positive cases infected with coronavirus at this point. And New York City has the most number of cases right now, the most number of deaths, in fact, in the United States. In fact, New York City has the most number of deaths compared to any country in the world, which is also such an alarming statistic, because you think about New York City, the Mecca, the bustling city, the financial capital of the world, and now dealing with this global pandemic. In fact, the United States right now has nearly 26,000 deaths. And here in the United States, we've been covering this on the ground day in and day out, and it's really a new normal for a lot of us. We never thought this would happen here. In terms of your question about the U.S. President Donald Trump and how he's handled this, there has been a lot more press conferences and media briefings that have happened of late. So this started around middle of March. So a few weeks back, we've seen a lot more press conferences, the White House Coronavirus Task Force giving these daily briefings and updates around 5 o'clock or 6 o'clock in the evening on what is happening, what they're doing, more about testing and these lockdowns. The concern that a lot of local states have is a little bit of a disconnect, because in the United States, it's not a national lockdown like it is in India. I believe in India, it's the entire country that's locked down. Here, it's state by state, because some parts of the country have more cases, and those governors, the heads of state, are being asked to manage and shut down those states. Not all the states, not all the 50 states have shut down. So there is a little bit of that uncertainty. A lot of people are in these uncharted waters, even healthcare workers. No one really knows, and a lot of that falls on the president. It falls on the leadership. What is happening? How do the states run and operate? And the biggest at this point, the effort is now being forced on is antibody testing and vaccines before the country can really reopen.
Well, Archith, who exactly calls the shots? Because Donald Trump claims that he does. He's been lashing out at the media because there has been a lot of focus on the gaps in the U.S. government's response after initial warnings about the pandemic, which is now spread throughout the country so far. And we have seen the war of words that have been happening between the governor of New York and the president of the United States. He says, I call the shots completely. I have the absolute rule. How do you explain that situation?
I think one thing that we can certainly take away from all of this is sort of the leadership, the way the New York governor has handled this. And there's a calm briefing every day around noon or lunchtime. And Andrew Cuomo talks about what New York has done, what they're doing before they get to those peak models, and making sure that the hospitals aren't inundated, versus perhaps the president's tone. And the president's tone has, fortunately or unfortunately, been more of, here's what the U.S. has done, here's what we're planning on doing, and this is really not my fault. And I think it's just that tone and the deflection of blame. And unfortunately, some people aren't happy with that sort of approach, because ultimately, whether you're a healthcare worker, a doctor, someone who's a everyday citizen, people want answers, people want comfort. And the United States president has lashed out at the media numerous times. This is nothing new. As a journalist, the president has talked about fake news and coined that term. And this has been happening even before coronavirus started. When it comes to something that the president doesn't like, whether it's the Washington Post or New York Times or CNN or any media outlet, typically, if it is criticizing or investigating what President Donald Trump is doing, and he doesn't agree with that, well, he quickly throws out the word fake news. And unfortunately, there's been a lot of back and forth. In fact, just yesterday, a CBS News reporter confronted the president at the White House briefing, asking President Donald Trump, why did he wait so long? Why did it take him so much time to decide to implement and take this more seriously? Because back in January, when the first case happened here, the first person who came back January the 7th, the president said everything is under control. We'll figure this out. And then we kept waiting and waiting and waiting. And now, unfortunately, we are the epicenter of a global pandemic. And we have the CDC, the Centers for Disease and Control, right here in Atlanta. We have the best healthcare system in the world. And sometimes it is a little surprising to see that one of the strongest countries in the world, one of the most powerful economies, now dealing with a situation like this. And where do we blame? Who do we blame? Are we ready in terms of do we not have enough tests? Did we not take action soon enough? I'll give you an example of what happened in the state of Georgia. I'm in Atlanta. So this is a southern state. We have about 14,000 cases, and it's not even been 2 weeks since we went on a lockdown. India, to compare, a country of more than 1 billion people went on lockdown even before the state of Georgia, which is about 10.5 million people, went on lockdown. And here in Georgia, fewer than 1% of people have been tested. We asked the commissioners, we asked the health district, we asked the governor, why don't we get more tests? The answer, they don't have enough tests. They don't have enough to get everybody tested. So right now, they're only able to test the people who are sick, older people, those with chronic health conditions, or those who exhibit those symptoms of coronavirus. But it's got to be at a level where it's serious enough. So if I exhibit those symptoms, that's what I don't.
Because I was reading in what you had pointed out, almost 60,000 people being tested in 1 week, and that is just 1% of the population there in Georgia. But if you're talking about pinning the blame, or do you believe it is just a cover-up? Because if he's blaming the president, Dr. Anthony Fauci, or now he's starting to blame the World Health Organization, also saying that it is very China-centric and he needs to halt the funding of the WHO, claiming that he has the ultimate authority also to reopen the economy because he was aiming for Easter. Easter is gone, but the situation has not improved one bit.
In fact, the situation, as you pointed out, has probably gone from bad to worse. I don't think it's definitely improved. In fact, most people were surprised. They were shocked that the president wanted to even open the country back up as early as Easter. Of course, Easter just crossed this past weekend. And the concern that the governor and the president typically say is they don't want to delay opening up because it'll affect the economy, and they don't want to put Americans out of job. In fact, the American unemployment rate, every week we get an update. I think it's 6.6 million people who filed for unemployment. This has had such a trickle-down effect in every way, shape, or form. Yes, people are social distancing. Yes, they're staying at home. And yes, they are following that to flatten the curve. At least here in Georgia, we spoke to some doctors at Emory University Hospital. The curve is flattening. That isn't the case in other cities like New York City. Maybe it's getting better. They don't have enough tests still. They don't have enough hospital beds. So going back to what President Donald Trump, he does care about the economy. Keep in mind, this is also an election year. 2020 was supposed to be all about the election, and the election has almost become an afterthought. This week, we know that former Vice President Joe Biden will most likely be the Democratic nominee. He's the only Democrat running. President Trump is a Republican. So a lot of the action that he's taken has been, you're doing this wrong, you're doing this wrong, what we've been doing is right, sort of has been the approach. And a lot of Americans are not comfortable with that. They feel disconnected. They feel frustrated that the United States has not done enough to protect them. I mean, look at the death toll. The death toll is unbelievable. 26,000 people. To put that into perspective, September 11th, one of the worst tragedies that New York City had, 9/11 was about 3,000 deaths. And we certainly don't want to compare tragedies. We don't want to talk about this versus that. But where's 26,000 and where's 3,000 people? And at least with 9/11, there was an end date in sight. In this, we have absolutely no idea. In fact,
and in comparison to the other European nations, though they have recorded a higher death rate, but the number of fresh cases of infection are now coming down. But it doesn't seem so, at least in New York, because it is on a daily basis where thousands of cases are being reported. But Archith, my last question to you, how exactly are you viewing India's stand? Because do you believe it was the key in the initial stages to take it very, very seriously, and a complete lockdown that has been imposed? This is the largest and the biggest ever lockdown that has been imposed. 21 days have gone by. It was yesterday's Prime Minister's message of extending it further for 19 days. How is the United States and you as a journalist viewing it?
I think that's a great decision, absolutely. Perhaps the execution could be questioned. I'll give you an actual personal example. My parents were in India when all of this happened. My parents were in Madras, in Chennai, and they took one of the last flights out to get back to the United States. Otherwise, they would be still, I wouldn't say stuck in India, but for lack of a better word, yes, they would still be in India. Perhaps India taking the action early on is certainly something to look forward to applaud. But I also want to point out testing is also imperative. I am not sure how much testing India has done compared to other countries. Hopefully they're doing more, but testing is really the key to figuring this out. Obviously, the more tests you do, the more you'll be able to figure out people who are positive, or you're able to control the situation. And the United States is certainly ramping up testing, but certainly not like some of the other countries have done. And that is one of the questions that people always ask. Should the U.S. have looked at South Korea, Italy, China early on to get ready and have these tests ready and available? Because some of these tests were taking 10 days to get implemented. Now we have more rapid testing, 24-hour testing, and drive-through clinics. That wasn't the case early on in March. I mean, we're now well into 6 weeks, and it's still...
Well, testing here in India has significantly been ramped up, and we are looking at a lot of improvement since the first day of the lockdown. And today being the first day of the phase 2 of the lockdown that has begun, and there is a lot more strictness that can also be seen as cluster zones that have been identified, and testing has been, significantly ramped up. That is one thing that I can confirm to you. Archith, thank you very much for sparing your time and getting us all the viewpoint that you view currently what's going on, especially in the United States of America, and India too, doing in its bid to reach out to its neighboring countries, and of course, the United States being an all-time friend. Thank you very much, Archith. Good night.
Absolutely. My pleasure. Thank you.